Hi, welcome back to Antai Hospital's YouTube channel. And in today's video, we'd like to share and discuss a patient case study at Antai Hospital. Now, this regards our HG vaccine, which is our effective treatment for Hyperemesis Gravidarum. Now, this particular patient has received our treatment, and the patient's spouse, who is his wife, was experiencing symptoms of HG. They came to Antai Hospital, received the HG vaccine, and within a week, they fully recovered. No more symptoms were observed, no more vomiting. She could eat and sleep. She was smiling. So they were sent home. However, the pregnancy still ended in a miscarriage 1 month later. Now they are very angry, anxious. They believe that the HG vaccine was the cause of the miscarriage. Now, was it truly the cause behind their miscarriage, or was it something else? So, upon looking closely on this patient's medical history, we realized that this patient was not only suffering from Hyperemesis gravidarum, she had miscarried several times in her past. So this type of miscarriage that she experiences is a special form of miscarriage. This miscarriage is known as a silent miscarriage or fetal demise, which means the pregnancy has already died, there's no more fetal heartbeat detected, or the baby is experiencing atrophy. Instead of getting bigger, it's getting smaller and smaller. This is a sign of fetal demise, but nothing has exited the mother's body, which means before miscarriage has happened, this has already been detected via ultrasound. This is what we know as a silent miscarriage or intrauterine fetal demise. And this is exactly what happened to her, and she believed that it was caused by this HG vaccine. But upon close inspection, we realized that this patient, because of Hyperemesis gravidarum, and only just found out about Antai Hospital's HG vaccine, she had already lost several pregnancies before that, up to 7 pregnancies lost caused by Hyperemesis gravidarum. Now, if you know anything about Antai Hospital, you will know that history of multiple miscarriages and multiple induced abortions to clear the uterine cavity, it can lead to a high occurrence of developing an immunological factor. An immunological factor, as we've explained so many times, is the presence of anti-embryonic antibodies caused by the presence of foreign tissues in the mother's body. Specifically, it's fetal tissues entering into the mother's body during the process of miscarriage or induced abortions. This fetal tissue contains paternal genes which is foreign to the mother, allowing her to develop these antibodies. These antibodies, when they are in the presence of any sort of pregnancy, if they are activated by the presence of a pregnancy in the mother's body, they quickly bind with the embryonic cells and damage its immunological barrier, exposing it to the mother's immune system. Very quickly, it will become a vicious cycle if not treated properly. Now, this patient, although Hyperemesis gravidarum condition was treated, she was not treated for her immunological factor, and then that's what caused her miscarriage. So at Antai Hospital, we've already tabulated that either a silent miscarriage, fetal demise, recurrent miscarriage, there are up to 43 individual causes. They cannot be caused by one single cause only. Usually patients who are much more advanced in their medical history, they have multiple causes. So this patient clearly has Hyperemesis gravidarum and our suspected presence of immunological factor, but it is very possible that she has other factors as well that she did not have treatment for. So at the end of the day, the cause of her miscarriage was not related to the HG vaccine. Our HG vaccine is highly effective and has caused not a single case of miscarriage, a success rate of up to 95%. And if there is any failure, it's because there is a presence of another factor. Of the 43 factors, there are other factors involved that was not diagnosed or did not receive timely treatment that led to the miscarriage. So this is important. Diagnosis is very key, comprehensive, full diagnosis, especially patients with multiple miscarriages. Your part as a patient is that you need to be open and clear, transparent about your medical history with your doctor. Do not only receive treatment for one singular disease and believe that you are already healthy and well and off, ready to be discharged. So Antai Hospital is able to treat these types of patients because we have a patented immunotherapy that is recognized over 30 over countries and scientists all over the world. It comes with a small DNA gene vaccine working very similarly in an injection. So for this patient, she will need to receive our HG vaccine and the immunotherapy as well. So we need to block the abnormal H2 receptors responsible for hyperemesis gravidarum, and then we need to eliminate the antibody reaction that's happening during pregnancy. So we can do that, all of that in Antai Hospital, and this can be done fully contractual basis, and it comes with a full refund guarantee. We take your pregnancies and miscarriages very seriously, and that's why we offer you full refund guarantee, because we are very confident that your next pregnancy, if you do receive treatment and diagnosis at Antai Hospital, if you follow our instructions, a healthy pregnancy is easily achievable at Antai Hospital. So if you'd like to find out more information, and if you enjoy content like this, where we share patient case studies so that you can be more informed, please subscribe, like the video, share this video to those who are keen, and especially for those who are experiencing hyperemesis gravidarum and seeking effective treatment. For more information, please visit the website and also get in touch with our consultants for more information on how to receive our treatment, and also leave me some feedback down below. Stay tuned to the next video.